The CDC stepping up efforts tonight to make sure everyone is protected from the disease. But tonight, many Minnesota nurses feel as if they are not prepared to handle Ebola, especially after a nurse in Dallas contracted the disease while caring for an infected person.
They are far too often the unsung heroes of medicine, the women and men of nursing who toil in the shadows of surgeons and people making hard decisions. But they are many times the people who carry out the instructions and do what might be considered the dirty work in medicine. And when the first Ebola patient to die in America was revealed, many of the initial reports hammered away at the nurses for doing things incorrectly and mishandling the situation. The nurses are fed up, and well, they should be, because they are now the ones being infected and the ones who could possibly die. Welcome to Midpoint. She was recently elected to a second consecutive 2-year term as the president of the Minnesota Nurses Association, representing more than 20,000 nurses in Minnesota, Wisconsin, and Iowa. Linda Hamilton joins us. Linda, thank you so much for being here today.
Thank you for having me.
Linda, I have a very good friend of mine who has been a nurse for over 20 years. When the nurse first was blamed in Dallas, I got on the phone with her and she was screaming expletives at me at a level that I cannot even begin to repeat. She said they're always blaming the nurses. It's always our fault. They look for us as nothing more than a way to go ahead and pass the buck and pass the blame. Is that how you and your fellow nurses feel?
Well, the problem with this is that there's a huge disconnect over best practices and also availability of equipment and also how to use that equipment. We have these hazmat suits to use and we need to have them. However, we have not had any training in that whatsoever. And we have not had good training in how to deal with the disease as serious as Ebola.
How long have you had those hazmat suits available to you, Linda?
Well, available to me, what does that mean?
Well, basically the hazmat suits that you have available for the nurses to use, how long have you basically had them ready to use or had them in your hands so that the nurses can use them?
We do not have them in our hands.
You do not at all? Okay, so you have none.
No. Not to my knowledge. There may be hospitals that have, but I'm not aware of that. And we asked nurses at our yearly convention, do they feel prepared to care for a patient with Ebola? And do you know how to use the protective equipment? And do you have that readily available? They said no, very clearly.
Is this something that you and your fellow nurses and the National Association have been calling for a long time and simply they're ignoring you?
Yes, but I think that this Ebola scare is a really an opportunity for everybody in America to look at how we deal with infectious disease. Today it's Ebola. Tomorrow it may be another epidemic. I can only tell you there will be one. History tells us that. And this is an opportunity that we can use to learn what we need to learn, because right now any infectious disease, the serious infectious disease that comes into our emergency department, we do not have the training, the knowledge, the drills we need to care for a patient immediately.
Who are the people failing to give you this training? Is it the CDC, the local government, state government, hospital administrators? Who is it?
I think there's a lot of failure. And in any real problem with medicine, you'll find there's a number of people who dropped the ball. And certainly the CDC dropped the ball in the fact they did not come out right away and say what we need to do to protect ourselves. The research wasn't there. And now they are equivocal about what is it that we need to use. We really need to use the hazmat suits and full protection, because we get exposed to disease. That means that we expose others, and that's not right. A nurse's job is to care for a patient, but also to protect our communities. And if we don't have the right equipment within easy reach, knowing how to use it, and having had the drills to prove that we know how to use it, we failed our community.
How much disgust does it raise, and probably the bile in the back of your throat, to you and to your fellow nurses when you see the head of the CDC come out in almost daily press conferences and say, well, we should have done this. Well, we should have done this. Well, we should have done this. It's a cover and a cover and a cover every single day that's out there.
You're exactly right. Like I said, there's been infectious disease throughout history. We know that it's coming. Why aren't we prepared? Why haven't we been prepared? And who's failed us, from the government to the health department to our employers, and certainly to our frontline managers are not doing what they need to do to protect us from these diseases, and then we cannot protect the public.
CDC Director Thomas Frieden is the one who makes all these statements. In your opinion, and those are the people that you talk to, should he be fired?
I don't like to make those decisions. That's not my pay grade. But I do believe that we need answers. We need a common sense approach. Hysteria isn't going to help us. Getting rid of any one person isn't going to solve our problems. What is going to solve our problems is we need to sit at the table and do the most that we can to protect our society from a disease such as Ebola.
There is also news today that the Center for Disease Control is going to consider adding the names of health workers monitored for Ebola and then put them on a no-fly list. And this would include the young lady right now, the 2 in Dallas, and others who are exposed. How do you feel about your members being put on a no-fly list?
Well, I find it really interesting because they haven't put on a no-fly list people who visit these communities in West Africa. They believe that there's a right to travel. At the same time, if you're exposed, like I said, nurses really know we don't want to contaminate anybody. And when I say contaminate, these are horrible diseases. We don't want them, and we sure don't want to bring it to our families, and we sure don't want to bring it to anyone in our communities, or now our community is the world.
Do you get the feeling then, you just mentioned, and we talked about flying here, but very briefly, should we then shut down our airlines and shut down airliners from coming here into America from infected countries?
I don't know the answer to that, because I could argue that both ways. What we need is good research. As I said, we have not put the funds, or we haven't put the time, or we haven't put it as a priority. It needs to be a priority so we know what the right response is. We need common sense here, and we really haven't had it. We need to sit down as nurses, as physicians, as any healthcare worker, as well as employers, hospitals, and the public health and politicians. We need to sit down and say, okay, this is what we have before us. This is what we know about it.
Exactly.
And
as someone who knows a lot of nurses in my life and respects them, I'm all with you. Lyndall Hamilton, thanks so much for joining us. And Midpoint will continue right here on the Newsmax Network.
Congress wants answers about U.S. efforts to combat the Ebola outbreak. Hi, everyone. I'm Olga Viverdi, and this story tops your Newsmax Now update. Health officials are on Capitol Hill right now. CDC Director Tom Frieden says he remains confident that Ebola is not a significant threat in the U.S. Meanwhile, Ebola screenings are expanding to 4 major airports today. Newark International, also O'Hare, Dulles, and Hartsfield-Jackson will check temperatures of passengers arriving from West Africa. In other news today, U.S.-led airstrikes near Kobani may be slowing down ISIS. ISIS has been hit about 40 times in the last 2 days, and Kurdish fighters near Turkey's border say they've been able to regain some ground. And finally, Apple's expected to introduce a bunch of new gadgets in less than 1 hour. Get ready. This picture actually showed up on Apple servers today of what could be the new iPad Air 2 and iPad Mini 3. Enjoy them. We'll have another update for you coming your way at the top of the hour. We hope to see you then.